All therapies are built on these skills, regardless of whether you're a CBT therapist, a PWP, a counsellor, you do IPT or anything like that, couples counselling, whatever you do. These skills are skills that you will have picked up and developed during your training in that modality. What can happen, though, is that over time, particularly if it is maybe on a rare occasion where we have a patient that we struggle to boundary, we almost forget about how to use these skills to maintain time boundaries. And yes, these skills are there for lots of reasons. They help the patient feel listened to, they convey warmth, they build that relationship, but also they have a really key role in maintaining your time boundaries. And sometimes when you're sat there in front of a patient and they're talking, your mind might go blank. I know mine has before when I was doing therapy work, clinical work. Your mind goes blank. You think, how am I going to stop this in a way which is sensitive? And that's the main thing here. We don't want to just bluntly interrupt patients because that probably will impact your relationship with them. We want to do it in a way which is sensitive. We want the patient to feel heard and feel like you're guiding them rather than feeling like you're steamrolling them and taking over the session. So here are some of those skills that you can use. The top three in particular are the ones that they're the nicest ones. I think they're like the softy, lovely ones. Reflection. So reflecting back what the patient said to you. Summary, summarizing what's happened within that bit of conversation. And empathy, using a phrase or a statement or something to convey that you understand that patient's difficulty. What these things have in common is that they're short things that you can do, you can say in a session, which can pause the patient's track of conversation. So let's say the patient is talking at length about something which happened in their childhood. You've identified as the therapist that this isn't going anywhere. It's not useful, and actually it might be causing the patient distress. Rather than letting the patient talk, which isn't helping anyone, or just butting in and just saying, how does that affect you now? Which is blunt and could damage your relationship. Instead, I could do something like say, so what I've heard there is that in your childhood, you didn't have a very good relationship with your mother. How do you think that's impacting you in the present day? So what I've done there is use a short, sharp reflection. The patient might get a bit like, oh, okay, I was talking. But because you reflected, they're going to feel listened to. They'll feel acknowledged. And then in that pause in the conversation that happens after that reflection, I can then throw in a follow-up question, which will guide us back to where I want to go as a therapist. Similarly with summary, I might say to a patient, is it okay if I stop you there? Because you've just told me a lot of really good things there. Summarize what they've told me. And then I might say, and so you said all of that about your past. Have you noticed that that's impacting you in X way currently? Or have you noticed that's impacting your relationships, or whatever question I want to ask? Again, the patient isn't going to feel like you've just steamrolled over them because you've used that summary. They're going to feel listened to. They're going to feel like you're on the same page. And then before they can continue on that tangent, you can then sensitively throw another question in. Empathy is another lovely way of doing this. I can hear from what you said there that you're going through a really difficult period at the moment. Have you noticed that that's triggering off your current mental health issues at all? Again, patient feels listened to, feels warm, feels lovely, soft, fluffy because the empathy. And then I've guided the patient back to something which is more helpful for the therapy process. In all three of those cases, I've taken control back of the conversation, but I've not done it in a way which will leave the patient to feel like I've just butted in over them and I don't care what they're saying.